Do you ever roll over in bed or sit up from bed, bend over to tie your shoes, or lean your head back to wash your hair, and the room is spinning, or you feel like you're spinning? You may have what's called vertigo, which is actually more common than you might think. Over 40% of the people age 40 and over have what's called vertigo. I'm Denice Justus with Salina Regional Health Center Outpatient Physical Therapy Clinic.
Denice, thanks for being on the show. What does it mean when we're talking about vertigo? Is it just mean somebody's dizzy?
It is. I mean, vertigo is when you have a loss of balance. You feel imbalanced, and it can be a balance where you feel off balance, like you feel like you're going to fall over, or it can be imbalance, meaning your vestibular system is off balance. So what that means is basically you have this inner ear system that keeps everything in check.
I've heard the term like rocks in the ear or whatever.
Yeah.
Is that kind of what we're talking about?
It is. In your inner ear, you have these calcium carbonate crystals called, they're little canaliths, like little tiny crystals, where people say rocks. That's where they get the rocks in the ears kind of thing. And they are in your inner ear. And if they become dislodged, then they can be traveling around in the semicircular canals of your inner ear, and that's kind of what makes you feel dizzy. So when they're dislodged and you bend over or you look up or you turn your head side to side, rolling over in bed, things like that, those crystals move, and it makes you feel really dizzy.
So you kind of talk about what brings it on, but I mean, so how do you treat that?
So how we treat it is what's called an Epley maneuver or a canalith repositioning. And so we do a head positioning maneuver where we basically turn the head so that the crystals come out of that canal, and then they are just reabsorbed in the brain system or in the inner ear. And so then everything is kind of back in balance again.
Do you actually trigger the vertigo in the treatment?
Yes, a lot of times people can feel really dizzy, so we always recommend that someone brings them for the treatment and to drive them home just in case they're really dizzy afterwards. Okay. But a lot of times only 1 or 2 treatments and you're good.
So you can see results that quick?
Yeah, sometimes it's really quick, and it also depends what's causing it. Is it from a head injury or some inner ear pressure from maybe a sinus or cold or allergies or something like that that's caused those crystals to dislodge. Or so sometimes that makes you really dizzy and brings on vertigo. And that's called BPPV, or benign paroxysmal positional vertigo. But you can also have other things that cause it too. It can be from sometimes medications give you a side effect of dizziness, or just various causes. You're having neck pain or tightness in your neck. So we definitely evaluate to find out what's bringing it on first.
If you're having dizziness, please talk to your doctor and ask for a referral to Salina Regional Outpatient Physical Therapy Clinic.